Bad news, if you take costly prescriptions, your out-of-pocket limit is going up in 2026. Let's talk about what that means for you. Welcome back to another episode of Medicare Happy Hour, the most fun you'll have on the internet while talking about Medicare. Today I am enjoying a vodka soda. So cheers, let's dive in. So first and foremost, what's going on? So the cap explained. Essentially what this means in 2025, so for this year, this was the first year they instituted a cap on prescription drugs. So essentially a maximum out of pocket that you would pay. And it was $2,000 in 2025. Now, a lot of people that take a lot of prescriptions, that was a huge savings for them. A lot of our clients have spent thousands and thousands of dollars per year on their prescription drug costs. So this was part of the Inflation Reduction Act. And what's happening for 2026 is it's going up $100 to $2,100. Why is this happening? The law ties future increases to inflation. As we all know, I have 3 boys. It's very expensive to buy groceries for them. So as everything continues to increase in price, they're adjusting the prescription drugs by $100 to reflect that essentially. So this is the max you'll spend on covered drugs annually. So this applies to all Medicare drug coverage, whether it's a standalone prescription drug plan, a Medicare Advantage plan with prescription drug coverage. Once you reach the cap, your plan covers the rest. So it's important to note here that you need to make sure that your drugs are covered by the formulary on your plan, because this $2,100 cap does not apply to you if they're not. So, before 2025, as I previously mentioned, there was no hard cap. A lot of people would spend thousands and thousands of dollars per year on their prescription drugs. The cap reduces the financial burden and it provides protection and predictability. Really, when it comes to health insurance and medical expenses, we're really looking for predictability. What can you just generally know what you're going to spend in certain circumstances? There are monthly payment options available. And this really benefits people who take specialty drugs, whether it's cancer, diabetes, etc. There's chronic conditions, patients who hit the cap annually. Most of those are people with chronic conditions or that take several drugs. If you take a few cheap generic drugs, normally this isn't going to apply to you, but for those of you that do take a lot of expensive drugs, this is going to be a huge benefit. Well, I'm sure it was in 2025 and it will continue to be. All right, so essentially what does this really mean for you? Essentially what it means is that your costs are going up by about $100 per year. So there's $100 more out of pocket costs for those who reach the cap. Now, I'll be frank, the way they use the math, and we have other videos on this, the way they mathematically come up with this 2,000 or now 2,100, a lot of people that potentially would have hit the cap in the past are no longer hitting the cap, but still going in knowing your worst case scenario is an extra $100 is a lot. That's really helpful for a lot of people. So it's better than the unlimited before 2025. You may see higher premiums on the Part G drug plans as insurers adjust to cover these more expensive drugs. And the copays and co-insurance could also change depending on your plan design. And again, as a reminder, it's critical that you make sure your prescriptions are covered by the formulary, because if the drug isn't covered by your plan's formulary, none of this applies to you. So what you can do. So there are other ways to save on drug costs. You can switch to mail order drugs. We know there's discounts. Ask your doctor. Sometimes they have samples, etc. Review your coverage during AEP. Like I've said a few times, the formularies are critical. So the formularies and costs vary dependent upon the plan that you're on. Look for the formulary in your current plan to ensure that your prescriptions will still be covered in 2026 and add a way that maybe they're not. You don't want them to change. If you know you're going to take a certain drug, you don't want it to all of a sudden be at a much higher cost for you. So see what tiers your drugs are still covered on. Compare those costs. And at the end of the day, I really recommend talk to an expert. Give us a call. We're here to help. We have thousands and thousands of clients that are going through this fall and want to make sure that they're getting the most bang out of their buck because they do take a lot of prescriptions.